So basically looking at the learning outcome too, and as I mentioned in this particular unit, this is the second session that we are holding. And in the second session, we're going to be looking at understanding, some of the compliances, statutory frameworks, and obviously the regulation which we need to ensure that we comply with when you are a standards manager or a compliance manager or a quality, manager within a particular organization, providing services in terms of health and social care, mental health services, working with children in particular. And in those cases, your responsibility is to ensure that your organization is primarily adhering to all the guidelines which are, required as per the Quality Care Commission and, the second regulatory body, which is the Professional Standards Authority, to be able to ensure that you are meeting, and not only meeting, but also ensuring that these policies, procedures, compliances, regulation are meeting the requirements of this statutory framework, which are laid down when you look at, a particular setup. So today's discussion on learning outcome 2 of leading practice in health and social care is looking at being able to. That means this is a practical learning outcome wherein we would need to look at some of the tasks in from a point of view of being able to do and apply, what we learn in terms of, let's say, statutory frameworks, regulation, and legislation to our organization or the organization that you currently work for. So be able to develop strategies for leading and managing, in an area of health and social care provision. So you could be a standards manager, you could be a compliance manager, you could be somebody in quality, you could be somebody in, procurement, you could be working in HR, you could be essentially somebody who deals with third-party contractors, or in some cases, you're dealing with multiple agencies working across multidisciplinary teams. Here is where you would need to be aware of the current legislation. What are the statutory requirements to be met in a particular setup, like a care home, old age home, a children's home, a nursery, or a setup wherein you are providing commercial services to client, but they are related to, say, for example, within the health and social care sector. So, for example, a Botox clinic, you're looking at any sort of treatment which is offered privately, but can be considered wherein that treatment then requires, aftercare once the patient has had that treatment. And that could be, where we are looking at applying the statutory requirements and, making sure that the setup or the organization providing those services is actually meeting or, at least having the requirements to be able to meet the legislation which has been put in place by law. Now, there are 3 assessment criteria in this particular learning outcome. We are looking at first understanding what is, legislation, what is statutory legislation, non-statutory legislation or frameworks. And then we'll be looking at understanding, who are the regulators which basically look at maintaining and, updating the statutory frameworks and legislation which is required to work within this sector. The second assessment criteria talks about analyzing a particular organization, and within that, you're going to be looking at, understanding organizational policies. Now, these policies and procedures that we have, things like a health and safety policy, things like a discrimination policy, an equality diversity policy. Just giving a very brief example here, we have these policies sometimes in paper or on paper within an organization, but what we want to be able to do is basically analyze them and see whether they have been put into practice, which then further, reflect on whether the organization is essentially following the mandatory requirements laid down in legislation or by regulation, which is required. Is the organization then following those policies and putting them into practice when they do or carry out their day-to-day operations? So here, the idea would be to try and analyze and see whether these organizational policies and procedures are in compliance with the legislative, statutory, and non-statutory frameworks in a particular area. And here, when it says in your own area, you might be working within a care home, a setup, or say, for example, any sort of a organization which is related to providing health and social care services, whether it's community services, whether it's private services, public services. You would be looking at taking hold of 1 or 2 policies from your own organization at your place of work, and then see whether these policies meet the compliance in terms of, the frameworks. That means, have they, one, been kept up to date with requirements to the time? in terms of how legislation has changed over the years. For example, health and safety policy was introduced in 1974, but it has been updated in 1998, and then it was again updated in 2018. If you look at Data Protection Act, this was introduced way back in the 90s, 1998, the Computer Misuse Act, the Data Protection Act, but it was updated with the GDPR guidelines, in somewhere in 2016. So is the company policy in compliance with the updated regulation and legislation which has been introduced for that particular area? And that is what you need to check when we say analyze organizational policies and procedures. The third assessment criteria basically talks about, looking at identifying areas in which changes and adaptation need to be done. And these changes and adaptation, again, need to be in their own area. That means you have to choose an area of your work if your role and responsibility within the setup tends to be related to compliance, standards, quality, HR. HR would be manpower recruitment, working with third-party agencies, procurement. You'll pick up your area and see if there are any changes which are required or adaptation to these policies which are required, which would help improve the areas of working. Say, for example, it could reduce risk in terms of injury to patients, clients, or even staff within the organization. It could help you mitigate any sort of risks which could occur when services are offered to clients. So those would be the areas or examples in which such examples is what you will look at using to talk about any talk about identifying the area in which change or adaptation is required, and then how would you modify your policy, the company policy or the organizational policy related to that area to ensure that they are absolutely relevant and proficient to meeting the requirements set out by CQC or the professional standards agency as far as the services or carrying out of the work is concerned. So a fair bit of let's put it this way, content to be covered in today's learning outcome, 3 assessment criteria. And if I switch you over to the presentation to look at what would be the indicative content that we are looking at covering, let me just switch you over now. So this gives you an idea that we are going to be looking at essentially, some of the legislative frameworks, understanding things or frameworks which are related to care standards, care homes, looking at some of the key acts which have been introduced in the last decade or so after the development of, the NHS Constitution in particular, and some of the acts which have become more relevant when we talk about public healthcare services in general, things like the Children's Act, the Children's Disability Act, the Disability Inequality Act, and also looking at the health and safety legislation when it was modified, in 2018. Now, we also look at certain areas in terms of compliance, which could be related to local authority. When we talk about councils and their role, or some of the local authorities that we look at in terms of playing their role in ensuring that some of the organizations meet those standards. They could be related to helping in creation of compliance frameworks with the national, standards operator like CQC or Professional Standards Agency. And in some cases, looking at the safeguarding policies which are now in place in most organizations which are providing health and social care services, be it to vulnerable adults, children, old age homes, things like that. And then in general, what we want to understand is what is how does this compliance, as I mentioned to you, apply to your organization? And then if there are changes to be done, how these changes and adaptation can be introduced into the organization from a point of view of these compliances policies. And the second and the third assessment criteria, which is organizational system of compliance and proposals for change and adaptation, have to be discussed with a particular organization in mind. In most cases, I would suggest that this could be your own place of work, and it'll be easier for you to pick out a policy or pick out an area wherein it requires improvement, which is directly related to the area in which you work or have job responsibilities, or your job essentially, or your role essentially has those roles and responsibilities that you can actually extract information off and put your opinion on in terms of how this needs to be looked at or changed or amended in order to ensure that there is maybe say further best compliance or a best practice, or in some cases, ensuring that it is meeting, the requirements of the standards operator, the professional standards, authority, PSA or CQC. Now, before we get into some of the discussions of the assessment criteria, I think keeping in mind, because I need to look at, discussing with you or giving you knowledge and information about some of the standards, the acts, the legislation, there are quite a number of slides in today's session. So I will be going through some of the slides, and it could turn out to be a bit of a monologue. But the reason I put this across upfront is that in some cases, if you're aware of some of the acts and legislations, it'll be easier for us to discuss and go through them. But in some cases, if you're not aware of all of them, what I have tried to do is encompass all of them today in today's discussion on the learning outcome 2, so that some of you who are doing this qualification from a point of view of stepping into the compliance or the quality role or the compliance manager role, then this presentation helps you comprehensively understand the legal frameworks, the statutory, policies and procedures which are required to be followed within a health and social care setup. So let's look at very briefly, just starting with the general definition of the 3 important words which are going to be used time and again, within this particular learning outcome. So one is legislation, second is statutory, and the third is non-statutory. So statutory framework and non-statutory framework. Now, when we look at legislation, essentially, if we look at the word legislation basically, means, if you look at the literal meaning of the word, this is the law which governs, or the law which is put in place by the Parliament, and it helps the government govern or put certain sort of boundaries in place to be able to make working of certain public authorities or related departments possible. So in a very crude sense, legislation refers to official law. That is the definition, and it includes legislation which are statutes or acts of Parliament. So when we look at, I don't know if some of you understand how an act is created in the Parliament. So there are ways in which, when we look at how, say for example, acts are created in Parliament, what tends to happen is that when you look at the legal system, if I just bring across maybe a small diagram or a picture in place in terms of how laws or statutes or legislation is basically created. Now this particular diagram actually shows how the bills are introduced in the Parliament. Bill is basically a proposal or a new law which is being introduced in the Parliament, which is supposed to be debated both by the House of Lords and House of Commons. The bill essentially starts off in the House of Commons or in the House of Lords and must be approved by both the houses before it becomes an act. Now, when the bill is introduced, it goes through several stages. It goes through first reading, second reading. I'm not going to go into details in terms of what that means, but they go through a particular process in which after the third reading, the bill is passed. It is, let's say, drafted and finalized in a way wherein it then goes into the House of Lords. And again, it goes to the same process, and the House of Lords also approves it. Then the bill is voted for, and if it is found in favor, then both the houses basically send the approved bill, to the Prime Minister. Prime Minister then presents it to the monarch, and in this case, the King would then sign off this bill. And once we get the royal assent, this then is passed as an act in the Parliament, and it becomes what is called the law. Now, with this in mind, if you look at the definition of legislation, and what we do is how legislation basically, or how acts are introduced over the years in the case of health and social care, they tend to be statutes or bills which have been introduced in Parliament, and over a point in time, once they go through the House of Lords and the particular process, get the royal assent, they then are passed as acts of Parliament, and they then become a law. Now, this is required to be followed by all organization, agencies, parties who are operating within that particular sector. So things like an Health and Safety Act or Children's Act of 2004, these are laws which have been passed in Parliament, and they have become what is called legislation. This is a law which is used now to govern and provide for services related to children, in particular within the UK. And this is under the Children's Act of 2004. Now, there are primary legislations and secondary legislations. So primary legislations always tend to be act or laws which have been passed in Parliament and then finally become an act. Secondary legislation tend to be regulation or orders or codes, which is interpretation of that act and then applied to a particular situation. And if that is applied to a particular situation in the case of courts, then that becomes, the practical application of that act, and that would be considered as what is called secondary legislation. Now, secondary legislation is usually delegated to a third party by the primary legislation to provide additional details or amendments. So when these acts, laws are put into particular situations and then they are taken to court for debate, or if somebody files in the court saying that I don't agree, or we don't agree, or we do agree, but this is a required change, then the interpretation of these acts are introduced as what is called amendments, and these then tend to follow in what is called the secondary legislation. Now, how does this legislation and what does this legislation mean in health and social care? So when we look at the application of legislation in health and social care, it means that certain regulations and policies and procedures which have to be followed mandatorily because it has been laid down in law. And these services are then to be provided as per those regulations which have been laid down in law. Then they would be frameworks which are then, this legislation is then basically used to create frameworks which then can be followed through across different setups which are providing health and social care related services to the members of public. So in this case, the operator CQC and Professional Standards Agency, they basically create the statutory framework which is required to be adhered to or mandated by that framework. All organizations working in this sector have to agree to and make sure that they are in compliance with that framework. Would be the reason why you would generally see statutory frameworks being created. Now, just as a literal example, why do you think a policy or a procedure is created? A policy or procedure is created because you're going to be looking at implementing certain things or going and acting, and there are problems or gap areas or issues which will arise. So as a standard manual or as a standard guidance, companies and organizations and departments and the various agencies create these policies and procedures. So if there was a problem which is to occur, if, for example, in an office, there is an incident which happens that leads to somebody getting injured, there is an incident logbook, and there is a particular procedure through which this needs to be reported to the Health and Social Safety Executive or the HSC. Now, why this has been done? If the company has lots of offices or lots of places, lots of staff working in it, then at some stage, if this is to happen as an ad hoc because somebody was operating something and got injured, then you don't want everybody or the CEO of the organization to rush and look at taking note of that and what has happened, how has it happened. So there is a procedure or a policy which has been set. And that would mean that if the person is received an injury, there should be a first aid box, it should be recorded. And then if it is a major injury or a life-threatening event, which can lead to fatalities, then in those cases, they have to be reported to the Health and Safety Executive as well, so that they can, for example, the COVID pandemic, if there were symptoms being diagnosed in an organization, the organization was mandated as per the policy to inform the HSC on a central line, and then HSC then puts in place certain other procedures and policies to ensure that this spread cannot happen and things like that. So that's a literal way of saying why a policy and procedure is created. Now, if you widen this up and then look at applying this across various organizations, that is where frameworks would be needed. So certain standardization would required to be done so that these policies and procedures can be applied across different organizations. And in those cases, the regulators like the CQC and the Professional Standards Agency and a lot of others like the King's Fund, the National Institute of Care and Excellence, a lot of these agencies work in tandem together to create these statutory frameworks. And these frameworks then set and provide guidance for service providers to be able to offer these services within a particular sector. Like, for example, NEST. NEST is a government body which is a pensions regulator, and it has been set up by the government to ensure that people are able to save while they are working within the organizations. And they have set the framework to ensure that this is how pension funds or other private operators would need to operate in the market and provide services to the members of public in terms of making sure that they're making statutory contributions towards their old age and obviously retirement, and in this case the whole policy of pension is put into place within the organization. So it is mandatory for us to understand, before we get into this learning outcome, to understand what is legislation, what do you mean by statutory and non-statutory and primary or secondary legislation, and how these are used to create frameworks by regulators like CQC and, let's put it this way, Professional Standards Agency, to ensure that all organizations are then compliant with this legislation when they are providing services to the members of public. Now, because I mentioned regulators a number of times, for your information and obviously knowledge, you need to be aware that there are two main regulators in this particular sector, and one is the Quality Care Commission and the other is Professional Standards Agency. And for the moment, just the names should suffice. We'll get into details as we go along in the other assessment criteria. Now, one such other question which will come to your mind is that what is non-statutory guidance? What do you mean by that? So statutory is something which is mandatory, I understand, but what is non-statutory? So when we look at non-statutory guidance is something which is primarily issued, by the government. And in this case, it means that bodies or organizations or institutions that work within the sector, but they are not regulated by law. That means they have, they are public-private partnerships or bodies which basically have an existence and have some powers that are not set out in legislation. They often tend to have a private function, and they will tend to provide, say, health and social care or services related to health and social care within the sector. Now, one such example that I would give you is if you can relate to what is called the Financial Conduct Authority. Now, this particular body, FCA, regulates banks and, in lending between banks, and looks at a lot of financial regulation and legislation, which all the bodies or organizations offering financial services or any such product of financial services provide. Now, this is a non-statutory body. That means this is a non-governmental body which is directly not regulated by any act, but they are also under the purview of the law, and they have powers which basically are not set out in the legislation when it is used. So their function is to monitor and ensure that there are fair practices being used in order to sell, provide, or administer these financial services to the member of public. So it is important again to understand the difference between statutory and non-statutory. Statutory tend to be legal, and they are generally enforced by law, regulated by law. But if I look at non-statutory, they tend to be not providing, or say they tend to be bodies which are basically not regulated by law, but they have powers which are generally not set out in legislation, and they would then tend to provide guidance to, or would be used to say, for example, maintain fair practices within a particular setup or a particular sector. Now, having understood this, let's get into understanding, because some part of this will be expanding into some of the assessment criteria. So the 2.1 assessment criteria talks about evaluating current legislative, statutory, non-statutory frameworks and their applicability to health and social care provision. Now, the reason we look at this is again a wide and vast, subject. When we look at law and how law is formed, how regulation is introduced, how legislation is passed, or a bill essentially introduced in the Parliament becomes a statute, and then at some stage it becomes an act, and then it is done through the introduction of this legislation. Now, what we want to be able to do is not get into detail, but we want to contextualize it to understand how it is used and relevant from a point of view of health and social care provision. Because again, being a vast subject, what we don't want to do is get into details of different types, but I have picked up the most important types of legislation and statutory and non-statutory frameworks or legislation here, which basically requires which is required to be followed, and this then leads to creation of frameworks by regulatory bodies. Now, in a simple way, if we interpret what is legislation, it is legislation is nothing but it is using the law to be able to implement or provide for services in a safe and legal way within the health and social care sector. Now, failure to comply with the legislation can lead to fines, can lead to suspension of license, can also mean restrictions on the services in terms of restriction in terms of funding, which some of the bodies receive from the government in terms of providing this. And it is used as a technique to ensure that there is in general compliance to these frameworks set out in the health and social care provision. Now, when we talk about health and social care provision, and we would generally in the UK be looking at the National Health Service and the social care services associated with the National Health Service or being provided through the National Health Service, and in some cases the voluntary services or charities or other organizations which work very closely with the National Health Service to provide these services to the members of public. Now, when we look at certain key legislations in health and social care, these are some of the key legislations that we need to be aware of. So, starting out with health and safety at work, which is called the HSC. It was initially introduced in 1974. We'll go into a bit of details, but this is just a listing here to bring to your notice that these are the bit of legislation that we need to be aware of, which is basically compliance with law, enforceable by law. And these are minimum standards which then form frameworks, and every organization within the sector providing services would need to have policy procedures in place to ensure that these legislations are implemented, followed, and the organization's general functioning is compliant and meeting these legislations. So you have the Health and Social Care Act of 2008, the Equality Act of 2010, Care Act of 2014, the Safeguarding of Vulnerable Group Act of 2006, the Mental Capacity Act of 2005, we have the Mental Health Act of 1983, you have the Liberty Protection Safeguard, which was formerly a different act, and then the Children's Act of 2004 and 2006. Now, what I've done in order for us to understand these in a bit more detail, I have created 1 or 2 slides to provide you a gist or a summary of what these particular acts essentially mean. And what does it mean in the context of health and social care? Because again, let's not forget, we are not looking at understanding these legislation or acts in general. We are looking at understanding them from a point of view of health and social care. Now, the HSC is essentially, as we talk about, is basically an act which was introduced in the early 1970s, 1974 to be exact, which is to ensure that the employer has a duty to ensure that the workplace is safe for the employee. And there are certain roles and responsibilities which are divided between the employer and the employee. And this is to ensure that the health and safety and well-being of the employees working within the organization is the responsibility of the employer, and that is maintained. Now, there are certain associated acts which have been introduced over the years in terms of ensuring that, that they are related to, if they are also implemented, they basically help in ensuring the safety and well-being of the individuals working within the organization. So there is one such act, which is the COSH Act, as we call it, which is essentially a short form for Control of Substances Hazardous to Health. And this was something which was introduced, if we look at asbestos, which is used in creating false ceilings within the offices, that is once it was discovered that is cancerous and can lead to cancer. Certain type of insulation within the homes and the offices, which is used to keep the buildings warm and obviously not lose heat during winters. They have substances which normally have been banned over the years, but once they were discovered, what has happened over the years is this particular act was introduced to ensure that there is regulation which has been put in place to protect workers which could be coming into harm's way because of the substances which are hazardous to health. So in most cases, when we talk about substances which could be hazardous to health, is sometimes when you see petroleum tankers and some of the other types of equipment being carried out, or when they are being transported on the highways, you would generally see these signs on some of these vehicles, and they could be, because the material that they are carrying is explosive, inflammable, they are corrosive, or they are dangerous in general to the environment. They are all covered under this particular act. Now, the other one that we talk about is REDOR. And REDOR basically is an act which was introduced wherein it is a mandatory duty of the employers or people who have employees as self-employed, or as people who are working in their premises as part-time or as contractors. The reporting of injuries, diseases, and dangerous occurrences was made mandatory under this particular regulation, which was introduced into 2013. And this requires people or employers or contractors to ensure that they are making in a way sure that the place of work, the premises are safe in terms of as a working environment for the employees, even for contract workers. And if there is an incident of any sort of injury, which could be, which is an injury essentially, not classified, but injury, a disease or a communicable disease, or any sort of dangerous occurrences of incidents which can happen, which can lead to accidents or incapacitation of workers because of that accident, will need to be reported, and they are covered under what is called the Reporting of Injuries, the Diseases and Dangerous Act, which was introduced in 2013. So these are, I would say, acts which are, introduced by the government over the years to ensure that, any such associated aspect of safety and well-being, which is required to be maintained, is then put in as a mandatory responsibility of the employer to ensure that the premises are safe, the working environment is safe, and in general, health and safety of the employee working within a setup is guaranteed. Now, there are other associated acts which have come up, which are related in general to the HSC, and they may or may not apply to all particular, let's say, health and social care organizations. But generally speaking, because within health and social care as well, there are lots and lots of different types of job roles. In a sense, there are 350 different type of job roles within the National Health Service. There are people who work as drivers. There are people who work as, administrators, people who work within, depots and things like that. And they are dealing with, and ensuring that the required material resources are available within key hospitals, setups, or departments for the purpose of providing services to the members of public. So when we look at the work regulation, this regulation was introduced in 1999, which mandated that employers need to carry out risk assessments annually to ensure that there are no risks which can arise because of changing environment or changing situations from a point of view of the work environment. And if there is, change which is introduced, or premises has undergone a change, or, for example, expansion, internal change in terms of restructuring, then adequate training and information needs to be provided to employees so that they are able to understand how, these risks can be mitigated. The next one that we look at is manual handling operations regulation. This one is basically in place where, people are required to move material or resources. And in those cases, if they are trying to move material which is, heavier than 20 kg or certain requirements, then they need to be provided adequate equipment training to be able to manage that, movement or manage that workload. And that should not lead to any sort of bodily injury. So in this case, if you look at, people who work within depots, departments, warehouses in particular, wherein materials have to be moved, if the weight of that material to be moved is more than a certain amount, then in those cases, during moving and handling, employees need to ensure that there is adequate equipment available, training made available, so that it doesn't lead to any sort of bodily injuries. Then we look at, health and safety screen, display screen equipment regulation of 1992, wherein because we have now increasingly become dependent on IT and we use PCs and monitors all the time. So employers here are required to do risk assessment for staff in terms of when they use display screens. And obviously there are certain rules and let's say certain recommendations introduced to ensure that if you are in front of the PC, you take regular breaks and, it does not affect your eyesight, or in terms of, when you do a lot of typing or input of data, it doesn't affect, or create any sort of medical conditions which could lead to some sort of disability in the future. So risk assessment has to be done, and that is normally done through the health and safety screen equipment, regulation. I've talked about RIDOR and COSH already. There are also other acts or legislation which have been introduced over the years. The health and safety regulation, which is for first aid employees, must ensure that there is adequate, first aid equipment or, first aid box, which is adequately stocked and should be available within the organization. There should be people who are qualified first aiders, which could act as the first responders in case if anything is to happen or an untoward incident is to happen. There are a few others that you need to be aware of. Now, they might, as I mentioned to you, may or may not apply directly to your organization. But if I look at public-private partnerships and we look at different sorts of organizations which work within the NHS, they would be, looking at employing some of these and ensuring that their policies and procedures which are compliant with these regulations. Now, one such that we can talk about and is quite relevant is, if you know that during COVID, PPE was in the news, personal protective equipment. Now, this PPE also, has there's a regulation around it. So employers in this case, when obviously the government and the NHS found out that there were lots of deaths happening because of transmission of the virus, especially to healthcare workers, doctors and nurses, and a lot of them lost their lives during the pandemic while trying to provide treatment and, care for the patients which were, suffering with conditions of COVID-19. It was later on diagnosed and introduced that, yes, PPE, there was not adequate PPE being provided, and the government later, if some of you recall in the news, placed an order worth £2.4 billion for PPE to ensure that every working, healthcare professional, doctor, nurse, or person working within any of the setups had access to PPE while they were, providing care services to patients, infected with COVID-19. So it could be for care homes, old age homes, any sort of a setup within the hospital, A&E, things like that. So here, things like gloves, aprons, visors, screen visors, things like that, which are primarily required to ensure no transmission of virus could happen, is generally, or transmission of, virus, transmission of, say, diseases does not happen, is basically ensured by the proper use of personal and protective equipment. Again, employers are here mandated to provide guidance. Some of this PPE is used and disposed of after each use because it can have infection or can lead to infections. And in this case, safe disposal and usage and then safe disposal of the PPE is mandatory, and for which employers are required to provide adequate training. Now, there are other regulations which I would probably not go through, but it'll be good for you to go through in the slides, things like, Food and Safety Act. We look at the electricity work regulations. We look at Civil Competencies Act of 2004. There are a few others which include health and safety, within Safety and Quality Act of 2015. We look at ensuring, say, for example, people who work as drivers or people who work within the various departments within the NHS responsible for example, transportation of blood, somebody looking at going to meet or transferring, organs and things like that. And they use different types of equipment while driving or, let's say, delivering some part of this to different places. They need to ensure that, everything is done. And in those cases, I would say motor vehicles, so wearing of seatbelts, which was a legislation introduced in 1983, amended in 2006, is required to be used when it applies. And this could apply to domiciliary care workers who go into homes and stay with patients as a live-in to provide care for certain days or weeks. And in those cases, they would need to ensure that the employer has made them aware of the motor vehicles wearing of seatbelts regulation, and they need to follow it. Now, we need to also understand one or two other agencies which have been mentioned in the indicative content, who are basically responsible for creating frameworks which can apply to care, related to care being delivered by a particular health and social care organization or a setup within the sector. Offsted is one of them. So when we talk about Offsted, basically what it basically means is that this is a body which basically is the Office of Standards in Education, Children's Services and Skills. Now, this particular body essentially, provides, let's say, frameworks or creates frameworks and standards which are primarily responsible for ensuring that, when we talk about 4 areas of work, which they monitor, things like education, behavior and attitudes, personal development, and services and skills related to leadership and management. When you work within a particular setup, they are responsible for ensuring that there is an adequate framework for these 4 broad areas. So when we talk about Offsted, Office for Standards in Education, Children and Services and Skills, we are basically looking at they working in close quarters with other providers and regulators to be ensuring that when services are provided to children, in particular related to Children's Act of 2004 and 2006, they are meeting certain standards as described and created in this framework. So we, for example, look at Offsted because they are an inspector or a regulator which will go in and check for standards, regulate these services which are responsible for providing care to children and young people. And this ensures that they have a rating scale between 1 to 4. So if you get a rating, or during an inspection, if you get a rating lower than a particular, or judgment, I would put it this way, below a particular level, then that would mean sanctions, limitation to your license, and obviously ceasing of the services being provided to the members of public by the provider. Now, the 3 main functions of Offsted remain that they are basically involved in raising standards. Their tagline says raising standard, improving lives. So their 3 primary responsibilities are to inspect, to regulate and report on areas like schools and organizations that are involved in providing education, training and care services to children and young people in England and Wales. Now, they look at providing judgments in 5 areas overall, and these 5 judgment areas tend to be overall effectiveness, quality of education, behavior and attitude, personal development, and obviously how leadership and management is managing the setup in terms of delivering some of these care services, educational services, training services to children and young people. And inspectors in this case, when they visit a particular location, particular setup, they will make judgments on these areas, and this report then will be published on the Offsted's website. Now, while they are a key regulator, their main role tends to be within education and training provision, but because education and training provision tends to relate to children and young people, that is why their role is also seen as a transformational role within the and in working in close quarters with some of the other regulators in the health and social care sector. So when we talk about certain standards being maintained, when I say overall effectiveness and standards being maintained, they are looking at care standards for homes, care homes. They are looking at person-centered approach. They are looking at say, for example, dignity and respect, and these standards tend to be what are basically defined, these are frameworks under which these standards are required to be maintained by organizations which are providing childcare services or training or care services in particular within the health and social care sector. Now, Other bits like consent, safety, making sure safeguarding from abuse, these are essential requirements under the framework in which the inspections typically happen with Offsted. Now, there are 13 or I think 14 care standards which need to be complied with, and these include, various standards like neglect, degrading treatment, unnecessary and disproportionate restraint that we get to see. I don't know how many of you recall, in some of the care homes, Panorama had done an investigation, undercover investigation, and where they covered systematic abuse of the patients being done by the staff in the care home in terms of restraining them, in terms of not feeding them, putting them into solitary confinement in certain rooms. And this was recorded, and obviously the undercover investigation led to the closure of some of the biggest care home chains in England because of disproportionate treatment and unnecessary force, which was used in order to provide some of the care services to patients within these places. Now, it also applies to things like food and drink, premises and equipment, how complaints are handled, how good governance is, or governance in general is put in place, and what is good governance. And then there are things like staffing. Staff needs to be having proper training. They need to be, ensuring that adequately skilled and trained staff is in place to be able to provide these services. And the display of rating, in terms of once the inspections happen, the display of rating is done on the provider's website, or the CQC rating, the Care Quality Commission rating, when the inspections happen, and once in 3 years or 4 years, are actually displayed on the website prominently to say, along with the latest report, so that if members of public are looking at taking services of that particular provider, they should be able to read into that report, in the inspection report or the report which is carried out the inspection in the last few years, and they should then be able to make up their mind around the 13 or I think 15 care standards, to be honest, that are required for by these organizations to be maintained. Now, any questions so far, on what we are discussing? Do let me know either through the chat route, or you can ask me, there and then. Now, looking at some of the acts, which are self-explanatory, but just very briefly, I will go through some of them so that you are aware that these are the acts and legislations that we are talking about. Now, when we talk about the Children's Act, this was an expansion to the 1989 Children's Act, and this reinforces, how children need to be safeguarded and protected at a particular place of, in a particular place. So whether it's schools, whether it's nurseries, the main purpose of this act was to ensure that, Britain is a safer place for children. Now, this act also allowed for the creation of a post of what is called the Children's Commissioner role, and this then works very closely, with the local authorities in the UK to ensure that adequate services and provisions are put in place to be to ensure that all children feel safe in whatever setup they are, whether it's school, nurseries, or any sort of community-related services that they go to, like after-school clubs or things like that. Now, the Child Care Act of 2006 basically provides powers to local authorities in order to be able to ensure that they can improve some of the facilities which children get in order to maintain an overall well-being of young children. Now, this act gives provision to local authorities to take children into, foster care, or, look at certain, conditions under which, if children are not getting proper care or are not being looked after properly and do not get the opportunities to schooling and proper say meals and other things, then the local authorities have the power under this particular act to ensure that they can they can enforce using this particular act. Let's say, I want to use carefully, so they can put into they can enforce certain things to ensure that children are getting these adequate facilities. If they don't, then they have the authority to be able to take children into custody and obviously put them into foster care or other places which would provide for these opportunities and well-being for the children. Now, the Disability and Equality Act ensures that there is no discrimination, meted out at the workplace. It replaces the anti-discrimination laws, which was introduced earlier. And this basically is also closely related to what is called the Disabilities Act, where we look at people, having physical disabilities should again not be discriminated against. And this particular act, of 2010, was basically, is to ensure that all organizations provide and have a very standard and a fair way of dealing with people who have disabilities. So that you cannot discriminate against by, say, for example, saying that, okay, if I'm, advertising a role of a receptionist, I might say that I only would want female candidates to apply. So this, in one case, is a form of discrimination, that you're rooting out men who would be eligible and would be able to apply for that particular role. So this is considered a discrimination. So when we look at Equalities and Disabilities Act, we are going to ensure that there are no policies or procedures within an organization which basically, in this case, ensure that there is any sort of discrimination which can be done, in the case of in enacting some of these. One second. Now, when we look at some of the other acts, things like the Health and Social Care Act of 2008, this is an act which primarily, is introduced as a regulation which places duty on the NHS providers to make sure that they have appointed a non-executive director in the setup. And this basically is looking at meeting the compliance regulation set out by CQC to ensure that safe care and treatment can be meted out to patients, members of the public. And if there is a situation which typically arises, then in those cases, there is an independent watchdog or independent person which can look into these complaints, primarily from a point of view of ensuring that the activities of a particular setup could be taken or accounted for, or could be held accountable. So these regulations basically contain definitions of services and activities that people must be registered to provide. And in some cases, if they do not contain some of these services and activities, then a different type of provider will be brought into place in order to replace that provider, or to introduce a system which will then comply with some of the legislative framework which has been put in place by CQC. So they have lots of different types of guidelines, but this legislation includes things like person-centered care, dignity and respect, need for consent, safe care and treatment, safeguarding users, and which is what I've actually covered, in relation to some of the guidelines which is given here. So if the setup does not have adequate staff which is fit for providing these services, then the regulator under this particular act has the powers to be able to enforce the system. And if compliance is not met, then some of the services can be suspended, or in this case, an alternative provider could be given the mandate to run those services till they are put into place by the provider. Now, one of the key things which we would like to look at in the first assessment criteria before we move ahead to criteria 2.2 is that what is legal framework for safeguarding? Now, legal framework for safeguarding was introduced as a CARE Act in 2014, which sets out very clear guidelines for local authorities to ensure that there is no abuse or neglect done when these services are being provided by a provider. Now, there are three such legislations which are directly looking at complying with safeguarding. One of them is Safeguarding Vulnerable Groups Act of 2006, the Health and Social Care Act of 2012, and the Mental Capacity Act of 2005. Now, these three acts basically ensure that, if you look at creating a safeguarding policy within your organization, then you have to ensure that you are meeting and having the mandatory compliances which are required to be put in place in relation to these three acts which have been introduced over the years. And they tend to be the Vulnerable Groups Act of 2006, Health and Social Care Act of 2012, and the Mental Health Capacity Act of 2005. Now, as long as these three acts are put into, are taken into account for creating a safeguarding policy within the organization, that would mean that you, as an organization, are meeting the legal framework requirements of safeguarding, and ensuring safeguarding from a point of view of providing these services. So when we look at safeguarding in general, and when we say safeguarding in general with regards to what it means, we are looking at safeguarding from a point of view ensuring that generally there is protection from harm or damage is available, and it is something which is provided for within the organization, which is providing services in health and social care. So if I look at people in organizations which are working together, they are working together essentially to prevent and stop any risks or experiences of abuse which can happen at a workplace. And this tends to be under the Safeguarding Act, which is, directly concerned with safeguarding vulnerable groups, which is also related to the Health and Social Care Act of 2012 and the Mental Health Capacity Act of 2005. Now, safeguarding in general is an action that is taken to promote the welfare of children, vulnerable adults, and this is to protect them from harm. And safeguarding also could mean that you're looking at protecting children from abuse in particular and maltreatment, thereby preventing harm to children's health or development and ensuring that children grow up to be a healthy adult, and they are then provided in an environment wherein they are feeling safe, and effective care is essentially provided for them to prosper, and opportunities are provided for them to be able to grow and develop into a healthy adult. Now, again, safeguarding is quite a big topic, but what we want to be able to do is understand an overview of how a legal framework for safeguarding is created, and that is created on the basis of these three acts, which are implemented within a particular health and social care setup. Things like examples like care home, old age home, or nurseries and things like that. Now, when we talk about assessment criteria 2.2, here it is talking about analyzing organizational policies and procedures. So what I would do in this case is, because it talks about own area, I would suggest that you would need to look at policies in your workplace, look at them from a point of view of evaluating whether they meet the legal compliance, and some of the steps that you would take in ensuring that they meet the legal compliances. You know about the regulation yourself. You are clear about some of the reporting guidelines or duties which are there with regards to that legislation. You are able to, if you are somebody who is responsible for those policies and procedures, you make sure that you keep them up to date. You check your records. You're making sure that you're aware of the key laws which need to be implemented at your workplace. And you also ensure that you are briefing your employees, staff, partners, contractors on these laws and compliances that have been implemented within your own place of work. You're ensuring adequate training in some cases if it is required, so that the staff is able to apply these at their place of work, at the time of their work, or when they are carrying out roles and responsibilities within the organization. And then you, as a manager, as a supervisor, somebody who's the custodian of these policies, ensures that there are regular checks that you carry out, which basically mean that these policies are robust, they are sound, and they are meeting and exceeding the requirements which are being set as far as frameworks or compliances are concerned. So when we talk about some of these, for example, and here just when we look at how these policies, what is the main reason why these policies are put in place? One is obviously compliance, but if I get into a bit more detail to say is that when I, as a health and social care person or a professional working within this sector, use some of these and understand some of these policies and procedures and use them while I'm doing or carrying out my roles and responsibilities, what I'm ensuring is that I'm protecting the public from risk of harm or some sort of danger by making sure that these policies are implemented. So it is basically averting incidents, helping in averting these incidents, ensuring that any sort of risks which are arising out of these situations are then used, or the policies are then used to mitigate that risk, and I understand what kind of role I play, what is my role in that in that particular context or that situation, to ensure that I keep patients out of risk, minimize risk to patients, or I keep them safe while I'm executing my roles and responsibilities. Now, in general, if I have to look at analyzing one such policy in my own organization, and if I look at a care setup, one of the clear policies that you would be looking at is the Health and Social Care Act of 2008. Now, there are certain regulated activities which CQC has prescribed they need to be followed within any sort of a health and social care setup, whether it's a care home, old age home, a place which is dealing with vulnerable children, providing services to vulnerable adults. You're looking at nurseries, childcare centers, say, for example, after school clubs, things like that. They have to ensure that these regulations are followed because they would keep the individual out of the harm's way. And these are defined as some of the regulations which I've listed out on the slide. So there is regulation 4, 5, 6, 7, 8, 9, 10, 11, just numbers, but that is how CQC defines them. So they are basically from regulation 4 to regulation 17. And they basically include things like the service provider needs to be a partnership or an individual. We need to know that they need to be fit and proper to, govern that particular setup. There should be general requirements in terms of ensuring the fundamental standards are maintained. There is a registered manager in the setup. The staff and employees working within the organization understand what is person-centered care. Some of the principles of person-centered care, things like dignity and respect, need for consent. And, when they do provide these services, they are also ensuring that premises, equipment, all related services provided to the patient, or, in this case, people are fit for purpose, and they are what are covered in this particular regulation. So I have used 2 slides here to show you how you would go about, ensuring that there is compliance with legislative frameworks and statutory and non-statutory, frameworks when you consider a health and social care organization dealing with these, looking at and then implementing these policies and procedures within your own area. So the Care Quality Commission registration process, basically when you fill up a form to open a care home or run any sort of a setup which will be covered under the purview of CQC, they will list down these provisions or regulations that you have to meet and fill once you are filing, an application form to open a particular type of setup, say, for example, an old age home or a care home. Now, there are bits and pieces that we need to understand in terms of how these legislation and organization policies help in sharing of information with local authorities, and how the local authority can help the organization provide some of these services to the members of public. So sharing of information between these organizations is quite important, and the sharing of information generally tends to be related to safeguarding people and young children and ensuring their welfare. And when I say welfare, what I mean by that is they are free from abuse or any sort of a harm which can be done to them. And then when we look at interpretation and application of some of the documentation, which is either a framework introduced by local authority, they need to be adapted into your policies to ensure that you have guidance available from them to be meeting some of the requirements while delivering these services to members of public within a particular area. And this ensures that the frameworks are there to ensure that the service being provided is meeting a certain standard, quality is being maintained, and across the whole organization, this is ensuring that the let's say the processes do not slip, or standards, let's say, do not slip, and the quality of care is provided for which the person is coming to that setup, to take certain services. And that would be looking at essentially analyzing the company policies and procedures to ensure they are compliant with the legal and statutory and non-statutory framework within your organization. So here you would need to look at picking up certain policies that are applicable within your own organization in your own area, and then use that policy to explain how this helps in you complying with legislation and the frameworks which have been set by, or regulation which has been, or introduction of, any such regulation which has been done by the local authority. If, for example, you're receiving any sort of funding, then you need to maintain certain requirements to ensure that the funding continues, and the inspections when they happen meet the standards, and that allows you to still access public funds to be able to provide those services to from your own organization to the members of public. Now, the last assessment criteria talks about identifying any changes that you need to make or adaptation that needs to be done in order to improve those policies and procedures in your own area of work or in your own organization. So here, what I would suggest is you would need to look at, essentially your own organization and see which policy and procedure you think is actually, deficient. And in those cases, basically take up that policy and then look at how you would look at redefine or basically change the procedure which would help meet the deficiency in that particular area. So as an example, what I would suggest is take up a particular policy and that you related with regards to what is the requirements of legislation, and if there is any compliance or any sort of compliance which need to be met in relation to local authority. Explain that briefly, and then basically look at the updated legislation which has been introduced, and then incorporate that as a change within the policy. That could be an amendment to the policy. It could be an amended version of the policy, of the quality policy being implemented in your location, and that would help basically meet this assessment criteria. Because it says your own area, so you will need to take up a particular policy that is working within your own organization. A simple example of this would be looking at data protection guidelines. When GDPR was introduced in 2016, and organizations were given 2 years to comply with the changes, the creation of a data protection officer, DPO. If somebody does not want your information to be retained in an organization, normally all organizations are required to retain that for a period of 6 years. But if you do have a request coming in from a member of public saying that please delete my information or delete my, or a request comes in, then the DPO needs to be put in, should be there within an organization, and that data protection officer should be able to handle those queries and questions. And this would then allow the DPO to handle the request, and that would be an amendment or a change which is required to be done in the policy to ensure that you are compliant with data protection regulation and ensuring that relevant access is available to employees who need to have access to that information on a need-only basis. So the introduction of GDPR and the DPO was essentially done so that information is only accessible by people who have requirements to access that information. So when I go into a surgery, for example, you would generally see the people in the front desk or the administration would have access to the patient record. Now, other members working within that surgery might need access, but that access will be restricted or will be made available on a need-only basis with the relevant permissions from the practice manager in the surgery or the designated person who's the data protection officer. And he or she would need to clearly know why you need to access the patient record and what is the reason behind accessing the patient record. And that would then inform the person whether this permission of accessing the record needs to be provided or not provided. And that would be an example of change in the policy which needs to be introduced considering the GDPR regulation. And it could be one such example that I've given, and there could be certain other examples that you could look out and take out with and read and see which policy in your own area of work is something that you use on a day in, day out basis, and that could be deficient, and what could be the changes that you would introduce in that policy to ensure that you're meeting the compliance and you're meeting the legislation or the mandatory requirement to when providing these services to the member of public. So that is what would help us cover the assessment criteria 2.3. First, you need to identify that policy, look at what change is to be done, and then implement that change, or basically talk about that change in that policy, and that would help meet this particular criteria. Now, there are a few additional handouts which I will put. There is a PDF guide, which is an NHS simple guide to improving services, which is up on Moodle, along with the copy of this presentation, and that would allow to get to understanding how sometimes these changes are introduced into policies and procedures, which will help in delivering better services, quality of care to patients, or in a particular health and social care setup when the organization is providing certain services to the member of public. So I hope this is understood, and if there are any questions at this stage, would be happy to take in terms of what we've discussed today. If there are, if you think of any questions later, you can drop me an email, and what I can do is come back to you with some additional material. But in general, these are two, additional handouts which I put in, which are directly in relation to, helping you build a bit more knowledge about how to develop strategies for leading and managing change within your own organization. And that is the NHS patient strategy, safety strategy, and then a simple guide to improving services, which is what will be available on Moodle for you to read for building a bit more understanding on learning outcome 2. So if there are any questions, feel free to ask me now. Otherwise, I will look at ending the session, and I will catch up with you next week. Don't forget, next week we're going to be doing learning outcome 3, 4, and then also the assignment discussion. So there are sessions on Tuesday, Wednesday, and Thursday at the same time, 9 a.m. Thanks so much for joining, and bye for now.